Hello, my name is Brian, and I am presenting with Emily, Lily, and Mia about healthcare, its current state, and its future. Healthcare is the industry that covers all things that keep citizens healthy. As many people disagree over the amount of funding of healthcare, this is currently a hot topic in the United States. Public healthcare is not mentioned in the Constitution. Because of this, healthcare for all is not a guaranteed human right, and the government is not obligated to provide it. However, many have taken the promote the general welfare notion from the Constitution's preamble as an indication that the federal government can pass laws pertaining to healthcare. Some have been able to manage quite well under the current system in the US, but the situation has always been a crisis for those without access to affordable healthcare. Since the COVID-19 pandemic, healthcare spending increased by 9.7%, primarily from federal spending and financial assistance. Despite this, healthcare is still difficult to afford and not of the highest quality. The Health Insurance Portability and Accountability Act was enacted by the 104th U.S. Congress and signed into law by President Bill Clinton on August 21, 1996. It is most directly associated with the protection of confidential patient healthcare information. HIPAA outlines how medical professionals can store, use, and disseminate patient healthcare information and provides for civil and criminal penalties for violations. In 2022, in response to the COVID-19 pandemic, Bernie Sanders introduced the Medicare for All of 2022 bill to the Senate. The bill ensured quality healthcare would be implemented over a 4-year period for all citizens in the U.S. It covered dental care, vision, hearing aids, insurance premiums, deductibles and co-payments, and more. Wayland v. Road was a case involving a New York State prescription monitoring law requiring reporting and storage of information concerning all Schedule II drug prescriptions. Patients filed a lawsuit claiming it violated their right to privacy and rejected the drugs, fearing their record would be used against them. The statutes were deemed unconstitutional and enjoined enforcement of the challenged provisions. Opinion of the U.S. healthcare system is relatively low. The compelling issue in healthcare currently is the high cost of care. More than 45% of American adults say it's difficult to afford healthcare, and more than 40% have medical debt. Cost of healthcare affects people's behaviors, like not taking the right dosages or not seeing doctors when they're sick, leading to serious healthcare issues and increased costs. In Switzerland, Swiss residents are required by law to purchase health insurance. No one is denied coverage for pre-existing conditions, and patients have direct access to all levels of care. No referrals are necessary. Maternity coverage is excellent. It includes prenatal care, all delivery-related costs, a week-long post-delivery hospital stay, and much more.
Haiti is a country where healthcare is a lacking aspect. 49% of households who cannot seek professional care noted financial reasons, and only 68% of children in Haiti are vaccinated. Out of the 8 million citizens, only 60% have access to any kind of healthcare, which isn't necessarily high quality, and other citizens rely on public facilities where they pay a minimal fee based on income and family size. The Robert Wood Johnson Foundation is an American philanthropic organization. It is the largest one focused solely on health. The foundation focuses on access to healthcare, public health, health equity, leadership and training, and changing systems to address barriers to health, more Democrat leaning. Medicare Advantage is a Medicare-approved plan from a private company that offers an alternative to original Medicare for your health and drug coverage. Republicans have long supported Medicare Advantage since the creation of the modern program in 2003 under President George W. Bush. But many legislative branches have said that Medicare Advantage plans are overpaid compared to traditional Medicare. The conservative state Mississippi ranks 49th in overall health. This is due to high drug deaths and physical inactivity. Healthcare for citizens is even worse for those who have been discriminated against due to their socioeconomic status, race, ethnicity, religion, sexual orientation, geographic location, or other characteristics historically linked to discrimination or exclusion. New Hampshire has been successful in their health industry. With low income inequality and reduction of uninsured citizens, New Hampshire rose to be first in health in the nation. However, regional disparities exist within the state, specifically the northernmost region of the state. Harvard Pilgrim Health Care and providers are working together to address health disparities in New Hampshire by increasing awareness, education, and access to care. Senator Rick Scott has proposed a plan that puts, quote, Medicare, Medicaid, and Social Security on the chopping block every 5 years, which will lower the beneficial effects of health care. This plan will cut funding for Medicare, gradually increase the age eligibility from 67 to 70, and transform Medicare benefits into a voucher where citizens would get a fixed amount of money to spend on private health insurance plans. In 5 years, we see healthcare funding increasing. With the Senate having a Democratic majority, with 48 Democratic seats and 3 independents that lean Democrat, healthcare will most likely become better. With the increased funds, the quality of healthcare will become better, causing more people to sign up. This idea requires change by individuals, systems, and communities. The future is centered on the people. Individuals hold the key to their unique path to health. Thank you for your time, and here are our resources.